Back in this country tonight, urgent new warnings about the spread of measles. The number of cases in Canada is now up to 17, 10 in Quebec, 5 in Ontario, and 1 each in BC and Saskatchewan. Even a small number of cases can multiply rapidly, and that's why health officials are urging parents to vaccinate their children, especially if they're traveling during spring break. Here's CTV's Heather Butts.
Highly contagious and on the move, measles is making a comeback, and health officials are pointing to a 2-dose solution.
The question is to be or not to be vaccinated. If you are, no problem. If you're not, you're taking a risk.
That risk now a growing concern, with at least 17 cases confirmed nationwide this year compared to a dozen in all of last year. Symptoms can be similar to those of a cold or flu before a rash appears, but it can lead to severe illness in some children, including pneumonia and swelling of the brain.
There are enough complications and worries that what you want is for your child not to catch measles.
With March break approaching, Canadians are being urged to be careful with social contacts and check their vaccine status before traveling. The airborne disease spreads through coughing and sneezing.
It's highly contagious. If you put one person with measles infection in a room with 100 people who are not vaccinated and susceptible, then 90 of those 100 will end up with the infection.
There are 10 cases in Quebec alone, almost all involving children, and making Montreal the country's epicenter, where some schools in the city have a vaccination rate as low as 40 to 50% in young kids.
Vaccinating their child is not just helping their child, but it's helping other children whose immune systems are not strong enough.
In Quebec, health officials are planning to hold vaccination campaigns at specific schools, but that's not until after the March break. Medical experts right across this country are urging everyone to be cautious and update their vaccines to help stop this spread. Omar.
All right, Heather, thank you.